All right, so part 6, last part of our video series here on ARDS and ARDSnet protocol and prone positioning. So summary here by me, Nick Riesenberg. So key takeaways, you want to remember the distribution of pulmonary blood flow, those lung zones. One being the least gravity dependent, two in the middle zone, three being the most gravity dependent, because those three factors of gravity, pulmonary vascular resistance, and cardiac output all need to be adequate to have adequate oxygenation, really perfusion. And with ARDS, you have a lack of perfusion because of that compliance, and then you have a lack of ventilation because that compliance, which also is a lack of oxygenation. So what oxygen you are getting from what little ventilation you are getting is even having trouble being perfused into the capillaries because of that compliance. So you need those three factors to be adequate to maximize the potential for oxygenating the blood, which will go through the rest of our bodies, which is well needed for especially people in ARDS that they are lacking that. So Pacelli's law, remember, just essentially the bigger the tube is in radius, and then the longer it is, and then the viscosity of the fluid inside, the pressure, will all contribute to how high that pressure is or how low. If it's a smaller radius, that's going to increase pressure. If it's a wider radius, it'll decrease it. If it's a longer tube, it's going to decrease pressure. If it's a shorter tube, it's going to increase pressure. If you turn on that faucet real high, that hose faucet's super high, you're going to have a higher pressure. If you turn it low, it's going to be a lower pressure. If the viscosity of the fluid is water, it's going to be lower because water is not that thick. If it's going to be oil, the viscosity is going to be higher. So ARDS is a lack of compliance. And you got to remember the 5 P's of ARDS therapy. So perfusion, positioning, protective lung ventilation, protocol weaning, and preventing complications. All 5 of those are dire in treating an ARDS patient. So ARDSnet protocol, protective lung strategy, same thing going with ARDS. That's the things we need to be in mind always. They have a compliance issue. They're not perfusing. They're not oxygenating well. They're not getting much ventilation. We need to improve that. And with the ARDSnet protocol, you get those lower tidal volumes that you might increase 1 ml, and you want to go low PEEP, high FiO2, high FiO2, low PEEP, all with the lung protective strategy. And then prone positioning. By proning our patients, we are improving that distribution of blood flow and the compliance issue by taking weight off the lungs and gravity, and giving them that the lungs are more of an even playing field with the gravity and the blood flow, that we can distribute it better and get a higher amount of oxygenation through that blood flow and increase perfusion to the rest of the body. So that is the majority of that. So I also have some sources. And here's first page of sources. Second page of sources. Breathe in the air. I got to help them breathe. There's parts of the lack of compliance. My first video, and look around. Choose your own ground.